is not just a disease, it's a reality that is affecting the entire nation and the globe too. Today we aim to spread awareness through Sir. Welcome, sir.
Hello.
Please tell our audience about what cancer exactly is.
So, cancer is uncontrolled population of abnormal cells that have characteristics to spread to other organ.
Yeah.
Basically, normal cells have checkpoint; they doesn't spread to other organ. But if the abnormal cell divide multiple without any control, and that have property to spread to other organ, it's called cancer.
Okay. So, what are the early signs and symptoms of cancer?
So, sign and symptom of cancer can mimic with normal disease, non-cancer disease. So, it is very important to diagnose. Some are very important warning signs that should not be never ignored. So, it depend upon the site of cancers. Every time the sign and symptoms of the different cancer may be different. So, from top to bottom, like unexplained weight loss, unexplained basically constipation or diarrhea, change in the bowel habits, any lump in the body anywhere, any bloody discharge or normal discharge, bloody discharge from the nipple, any change in the shape of the breast, and any change in the voice, particularly hoarseness of the voice is a sign of vocal cord cancer. Blood in urine, blood in stool. So, any abnormal symptoms that persist more than 4 weeks may be cancerous. So, any symptoms like that, we should consult the nearby clinician.
So, basically, you said that because all these things are basically other problems of the body.
Yes, yes.
So, if all these things are prevalent or it is there for more than 4 weeks, then we should get checked.
Correct. So, any abnormal symptoms that persist for more than 4 weeks,
Yeah.
like pain abdomen, maybe like in the gastric ulcer, normal acidity
Normal
because of
cough?
acidity, normal cough, headache may be normal symptom because of stress or so many factors, but headache may be the sign of brain tumor also.
Oh.
So, it is important to basically notice the symptoms, and the duration of the symptoms are very important.
So, currently in India, what is the most prevalent cancer?
So, in females, breast cancer and cervical cancer are the most common.
Okay.
In male, oral cavity and lung cancer are the most common cancer. Other cancer like colorectal, prostate cancer are also common.
So, what are the risk factors and how people can prevent cancer?
So, again, the risk factors are very important, and on the basis of risk factor, we will come to know that more than 50% of the cancer we can prevent. So, most common risk factor is the tobacco and alcohol. These are the most common. So, tobacco and alcohol, unhealthy lifestyle contributes to more than 50% of the cancer. Some risk factors are not basically, we cannot change that risk factor, like genetic and environmental factors. Some because of infection again we can prevent, and some because of related to occupational. But tobacco, alcohol, unhealthy lifestyle like obesity, basically unhealthy diets are the major contributing factors.
Yeah. So, basically, we hear about cancer a lot. So, what are the stages of the cancer?
So, broadly, if we talk about the stage, we divided cancer in 4 stages, like 1, 2, 3, 4. In some cases, we also say stage 0. Stage 0 means before starting the cancer.
Okay.
But broadly,
so can we detect it
yeah,
at
yeah.
stage 0?
Stage 0 can be detected with early screening program. So, stage 1 and 2 are the basically early stage cancer. Stage 3 is called locally advanced stage cancer. So, it depends upon the site of tumor. Like if disease is localized to the site of origin and doesn't spread to other organ, that is up to 1, 2, 3 stage. In stage 4 means tumor spread from the primary origin to distant organ. Like if breast cancer spread from breast to lung, liver or bone. And if disease is localized to same organ, that is curable. In stage 4 cancer, though we cannot cure, but we have very advanced treatment. We can prolong the quality of life, we can prolong the lifespan with minimum toxicity.
Okay. So how can we make this cancer treatment accessible to the rural area?
So, this is a very important question because in rural area we have lack of basically investigation, we have lack of awareness. Patient doesn't know the sign and symptom of cancer, even they know they don't have facility for investigation. So, primary health care strengthening is very important. Screening program, mobile screening unit, digital consultation, telemedicine, we can consult like specialized doctor is not available in rural area, but that can give advice through this media. And the awareness that they should not ignore the symptoms. These are the basically warning signs that we have discussed. They should be aware and they should know that in rural area there is a stigma of the cancer, but we should educate them, we should basically aware them that if we detect cancer in early stage, that is highly curable, because otherwise cancer means death sentence, which is not at all as of now.
Hmm. So as you just said that there is a lot of stigma around
Yes.
cancer.
Yes, yes.
So how can we address that?
So awareness, like that, like we are discussing today, awareness is the very important key, because first of all, cancer is not contagious. Cancer is not spread by anything like basically like khana khane se, we share the basically food or anything like that. It is not through, it cannot spread through air like other tuberculosis. So it is not contagious. And second thing, it is curable. In early stage it is highly curable. Even in advanced stage we can prolong the cancer for many years.
So sir, what are the preventions of cancer?
So as we discussed today, more than 50% of the cancer are preventable, as the most common cause is basically lifestyle related, like tobacco and alcohol use, unhealthy diet, and basically obesity. So good healthy diet, yoga, meditation, and no alcohol and tobacco prevent the 50% of the cancer. Some cancer are related to infection, like cervical cancer in women and hepatitis B related liver cancer, that can be prevented through vaccination. Some cancer cannot be prevented, like genetic and environmental related, but that
hereditary ones.
hereditary one.
Yeah.
But for these cancer, screening is very important. So we can detect these cancer in early stage. In early stage cancer, the cure rate are very high.
So sir, what is your message to the people and our audience on this cancer day?
So the take home important message is cancer is preventable.
Yeah.
Cancer is treatable. Do not ignore warning sign. Go for healthy lifestyle without tobacco and alcohol. And vaccination is again important. Screening and early diagnosis is very important, because early diagnosis can save many lives.
Yeah. So thank you so much sir for your time. I know this interview is going to be very insightful for all our audience, and they'll go for screening and they'll do their routine checkup. As sir just said, cancer is not a death sentence. So we should keep on spreading awareness, talk about cancer, and let people know that cancer can be cured. Thank you.